Hello and welcome to the Community Voice. I'm Fara Sax. With me today is Dr. Libby Watch. She is a board-certified vascular surgeon with Miami Vascular Specialists. They are a practice is known nationally, renowned as experts in vascular surgery and treatment. So it's a mouthful. There's a lot to cover today, but I really appreciate you coming to visit and to share all that there is to know about vascular surgery and vascular and veins and appreciate you being here.
Thank you. It's an honor.
Thank you. Oh, that's so sweet. Oh, my honor. So let's talk about a little bit about your background, how you came to Miami, because you're not from here personally. You're from Orlando area, but your travels have been through the world quite a bit.
Yeah, so I am a Florida native, grew up in Central Florida, and went to Florida State undergrad, went to medical school in Israel, did 7 years of training in general surgery at the University of New Mexico, which I loved, and then really focused my training on vascular surgery in Wisconsin, in Milwaukee, Wisconsin. And then this was my first job out of training to come here to Miami to join a premier vascular surgery group.
And you've been here many years with the group. With the
11
practice.
years, yes.
That's a long time.
Feels like an instant.
And it's interesting. We have a lot in common. I have two kids that are living in Israel, and we spent when I was reviewing your bio, it was like University of New Mexico. Nobody goes to the University of New Mexico except me and you.
Entirely off the beaten track. Exactly.
Great place, the land of enchantment. It is truly enchanting.
Yes, absolutely.
So let's talk about what you treat at the Miami Vascular as specialists. In the group, there's there's such a wide range of things.
So vascular disease really encompasses several different disease processes. So I treat carotid disease, which is surgery to prevent stroke. I treat aneurysm disease, which is life-saving often. I do a lot of what we call critical limb ischemia, which is just making sure patients have enough circulation to their feet to heal wounds that happen on the feet, specifically diabetic patients. I also help other types of surgeons, cancer surgeons and cancer resections, and assist in those areas when the arteries and veins are involved. And also we do a significant amount of venous disease, treating patients who have deep venous thrombosis, superficial vein disease.
What is that? What is that?
So superficial vein disease is what I'd like to talk about today is focusing on what a lot of us would call varicose veins. So when you look at your leg and you see that it's you've got veins bulging out, sometimes that's just your anatomy and that's just how it is, and there's not really a problem there, and sometimes there is an underlying problem that can be treated if your veins bother you. So that's a part of our practice that vascular surgeons, as we are trained in all vascular disease, are really focused on treating here.
Interesting. And you came today with a slideshow, and we're going to talk about exactly what you're doing and how we can get better. So we're not talking about like spider veins that your great grandmother had and you inherit and you I'll go, oh my God, I don't want to be my grandmother, but here I am. It does happen. So we're talking about problematic situations. Is that right?
Well, we'll talk about a couple of different vein problems, including spider veins, which we do treat in our office. It's primarily a cosmetic problem, but we're happy to take care of it as well.
But when someone has varicose veins, it's not something that a dermatologist would take care of. It's something we have to find out what the underlying disease is that are causing this varicosity. Is that correct?
Exactly. To really understand what's going on with leg veins, you have to do a good physical exam, take a good history, and then do what's not an extensive workup, but a workup to really understand the pathology of what's going on.
And what causes varicosity?
So there are a number of things that cause varicose veins. Part of it is genetic. If your parents have varicose veins, you have about a 40% chance of having varicose veins yourself. A sedentary lifestyle and sudden weight gain can worsen varicose veins. Being on your feet, they're more common in women. So they are probably related. They are related to the estrogen cycle. And in addition to that, there are clotting problems, or what some people call phlebitis, that can lead to worsening varicose veins. So if you have a history of a deep vein problem, which is a sort of a separate issue, but if you have a history of that can also lead to your superficial veins being abnormal.
Do women, when they're pregnant, deal with this because of estrogen or weight gain or?
All of the above, yeah.
Oh, really?
Yeah, and also taking on fluid, which increases the venous pressure, can make our varicose veins worse during pregnancy.
Is varicose veins also related to some heart problems?
So there are some connections, but it doesn't automatically mean you have a problem with your heart if you have varicose veins, but there are some connections between the two.
Interesting. Well, let's take a look at what we have here to explore together.
So I wanted to show this picture because a lot of patients come to me and they don't like how their legs look. And I think it's important to set expectations. Jessica Simpson was voted the best looking legs in America. And from this health magazine article, there's some great photos of her legs. And when patients come to me and they tell me my legs don't look great, I have to remind them that I'm not a magician. I can't make your legs look like they looked when you were 18, but at least you have some idea of what we can offer. But this is a very nice looking pair of legs, very muscular and no dilated veins.
And also with this is if there is some varicose veins, is it life-threatening?
Varicose veins are not usually life-threatening. No,
Oh,
absolutely
okay.
not.
So it's just not pleasant to look like a map of the United States on your leg kind of thing?
So there's cosmetic, but there's also symptoms that go with it. So patients can get swelling in their legs, discomfort, restless leg syndromes at night.
What is that? What is the restless leg?
Restless leg is sort of you fall asleep and your legs just keep twitching. And then there's generalized achiness. So, the idea that maybe your grandma came home from a long day being out on her feet and sort of rubbed her legs and put them up. That's really good treatment because basically it's the pressure in the legs that causes that achiness, that swelling, and that discomfort. But they're not life-threatening. Very occasionally venous disease can be limb-threatening, but not usually.
Because I know that when I was pregnant or when I was waiting on tables in New York, I wore pantyhose to
Uh-huh.
try to counteract that.
Yeah, and we've gotten away from pantyhose. I think,
Oh my God, in 95-degree weather with 105 feel, I don't think I'd want to wear them right today.
And it's tough. It's a tough sell in Miami because we do recommend patients with varicose veins wear compression stockings. And it's a tough sell in Miami to get people to wear compression stockings. I wear them because I don't want my legs to be swollen at the end of the day. So they are helpful, but it is tough to get people to do it.
So when you're flying on a plane, that's another thing that I wanted to, I know we're on our slideshow, but when you're flying on an airplane and they tell you to wear compression socks, what's the reason for that?
It's just to prevent deep vein thrombosis from happening. It's actually not a varicose vein issue. That's a deep vein issue. It compresses the veins, keeps the blood moving. And if you have any valve problems, veins have valves. If you have any valve problems, the compression stockings will help counteract that. They're really just anti-gravity compression stockings. The whole idea is that blood needs to be returned to your heart, and the compression stockings press from the foot all the way up to help return blood.
And I remember when I was pregnant or when I was waiting on tables, I'd put my feet against the wall and just lay there, and so that the blood would go the other way.
Feels better, right?
100%.
Yeah.
You don't do that right about now?
we just put our feet up right now and relax. Well, I've got my compression socks on.
Well,
so
I don't.
have
I'm
to.
not even wearing stockings.
I know.
We're not taking it any further. Okay. What are we looking at here at varicose veins?
So this is an example of a varicose vein. That is this is the inside of the left calf. This is a typical location for a varicose vein. So the superficial veins run from your groin all the way to the top of your foot. And this is a vein connected to that main superficial vein that's popping out. Now, this on its own, if this patient isn't bothered by it, doesn't need to be treated. There's nothing bad that's going to happen to this vein. It's just popping out. But if you have swelling associated with it or itchiness or achiness at the end of the day, then it would be a sign of something worse happening in this what's called the saphenous vein that could be treated.
So how would you treat this? Let's just say if that patient wanted to have that taken care of at your practice.
So it depends on what's going on in the superficial vein. So we do an ultrasound, which is a painless procedure, just like when you're pregnant, you have an ultrasound to look at the baby. We look at the veins in a standing and sitting position, and we determine whether the valves are working. And if there's a problem with the valves not working, we have a couple of different treatment options. They're all done in our office without sedate. We do it with minimal sedation or without sedation, where we eliminate the main trunk of the vein that's causing this varicose vein to pop out. Now, if that vein is totally normal on the ultrasound, totally normal, and the patient's still bothered by it, we can do a little procedure where we pull that specific vein out with a very, very small incision, and again, just a little bit of sedation.
So these veins don't really go to anything in the body. They're
That's a
just
really good question. Yeah,
I mean, I always because I had spider veins and I
Uh-huh.
just had them zapped.
Injected, yeah.
Yeah, and it was like, okay, but were these useful veins?
Right.
Are they they connected to something really important in my body?
So that's a really good question. So these veins are not absolutely necessary for your circulation. The deep veins in your body are absolutely necessary. If those get blocked off, you got a real problem. That's when you have to go on blood thinners, and it's going to be harder to walk because of the swelling and all that. Superficial veins are a duplicated system that we were given. And that vein is very nice for other uses. It's actually what a lot of heart surgeons will use to do a heart bypass.
Oh, so they take it from other parts of the
Take
body?
it from the leg and use it for a heart bypass. We use it to do artery bypasses. So it's a duplicated system.
What's an artery bypass?
When somebody has a blockage in their artery in their leg and they need flow to go past that blockage because their foot hurts or they have a wound on their foot. This vein, it's called the saphenous vein, can be used for that. Everybody has a saphenous vein. Probably 25% of people, if we looked at it, it would be abnormal, but that doesn't mean it has to be treated. We only treat patients that have a saphenous vein abnormality that it really bothers them.
Got it.
And that's one of the best reasons to see a vascular specialist for this problem and not a non-vascular specialist, because we really understand the importance of that vein and saving it for later if you need it, and only treating it when it absolutely should be treated.
And you're located in Kendall. You're at the Baptist Main location at the 8950 Medical Arts Building.
That's correct. We're at the Medical Arts Building at Maine Baptist.
And
correct.
how many doctors are you working?
We have 7 surgeons in our practice.
Wow. Everybody working on their legs. Everybody working on legs.
We are.
Okay, so here we are. What do we see here?
So in this picture, which is another varicose vein along the front of the knee, and then you can see a little bit of discoloration. So these veins most likely developed small clots in them, something we would call phlebitis or superficial thrombophlebitis. So that's why they're darkened, and you get some discoloration. Can we go to the next one?
Sure. Oh boy.
So it's a big jump from the previous picture, which is varicose veins with discoloration, to this picture. And this is a patient that has a real problem that the veins have just not been draining for a long time. And in these patients, we have to absolutely figure out if the superficial veins are working. And if they're not working, we close them down. And by closing the vein down, all the blood then goes to the deep system, which should be functional. And I show this picture because some doctors will show this picture and say, if you don't treat your varicose veins, your legs will look like this. And that's not exactly
That's
true.
a scare tactic. Okay.
So we don't want to hold our patients hostage. That's not exactly true. This is a severe case of a patient who actually has both deep and superficial vein problems.
Okay, so I'm looking at the skin behind it, and that also looks dark, and so there's no circulation. How does that kind of thing happen? I mean, it's kind of scary behind me. I'm looking at it. Oh boy.
So it's important to know that this is a really advanced case. So we do see these cases, but it's not, most patients won't end up like this. But most patients, can we go to the next slide? Most patients will have a little bit of discoloration of their feet to start, and then they'll lose the color in their leg, and that's sort of an advanced stage, and then the wounds will break down. So if you see in your leg or your loved one's leg some discoloration that's in that area on the lower part of the leg, not necessarily on the foot, but the lower part of the leg, that is a vein problem. And it doesn't mean you need surgery, and it doesn't mean that you're going to lose the leg, but you should be seen by a vascular specialist who can at least do the studies, figure out if there is an anatomic problem, something that could be fixed, and what the best treatment options are. And sometimes the best treatment options are just to wear compression stockings, keep your legs up at the end of the day, and do things like control blood pressure and fluid intake and all of that.
Right. So what would be let's talk about the treatment of this poor leg.
So
do you have to treat the wound too, so that it doesn't get infected?
Yeah, so we do wound care on these, and these wounds do get infected because they take a long time to heal. So in my office, we do wound care on these lesions. We often wrap the leg tight to keep all the fluid from accumulating in the wound. Plus, we treat the actual wound bend. And then we look at the veins and determine what needs to be treated. So we are actually part of a new study where, for the first time in a long time, a new treatment for deep vein problems, where we actually can implant a valve into the deep vein in the thigh that will improve the flow, because the blood flow is instead of coming back to the heart, it's sort of sitting in the leg and causing all that darkening of the skin.
So it pulls it all. So this helps it like flush through.
Exactly. And so I show this picture as not a warning that your legs are going to end up like this if you have varicose veins, but at least an understanding that if you have a problem like this, we are the ones to treat it. My partner, Dr. Michelle Taubman, and I are part of a study that is implanting valves. It's an ongoing study, and we're hoping to help patients with wounds like these.
And how many have you implanted?
We've implanted 5.
And what was their success rate afterwards?
So far, we're still following them.
Right. It's so new, but
yeah,
this is groundbreaking, cutting edge.
It is, and it's
very exciting.
It is very exciting, because these patients for a long time have suffered with dressings really for the rest of their lives, and sometimes the wound heals a little bit and then it comes back, and we don't have a great treatment option. So this is the first promising treatment option we've seen in a long time.
Right here in our community, right in your practice. This is wonderful.
It is.
Kudos to you and your doctor partner. That's
Thank you.
Wonderful. So when do you really have to start worrying? Is there more?
Well, I think there's one more.
Okay, let's go there.
Okay, so this is sort of what I like to put on the slide.
I can so relate. What about you, Dr. Watch? Oy.
So a lot of patients will come to me and they'll say, oh, my grandmother had these horrible varicose veins, and I don't want varicose veins like that. And all they really have are spider veins. And look, everybody wants to wear shorts. Everybody wants to look good in a bathing suit. So we also have, I just want to point out, we have treatment options for that. We do an injection with a soapy material, Sotradecol or polydocanol, which can sort of burn those veins and shut them down. And that, if you're looking for a cosmetic result, I just want to make sure that people know we have that. And when you come in for that, we also make sure that there's not some bigger underlying problem that should be looked at as well.
Absolutely. What are some of the warning signs that the patient coming in, I'm in trouble, or I am going to need your services at the Miami Vascular Specialists?
So beyond a wound on the leg, which is always a big warning sign that takes more than 4 weeks to heal, the things to look for are constant swelling in the legs that gets worse at the end of the day, and achiness that just doesn't seem to resolve, that you have to take over-the-counter medications for, or bigger veins popping out. Those are the things to look for. The more subtle problems are things like restless legs, like having trouble sleeping at night because your legs are moving about.
And the practice does take insurance, so you can help evaluate. I'm not going to ask you to name all the insurance companies.
We do take a wide range of insurances.
That's
yes.
Good. What tests do you perform to evaluate these? What the next course of treatment would be for varicose veins?
So that's a great question. We have a fully functioning vascular lab in our office, and when patients come in, first, you get a good history and a good physical exam to determine if there are any problems that could be happening with the arteries as well. Usually in young, healthy patients, there's not, but we can check that on physical exam. And then the main test that we do is an ultrasound to just look at the veins. It's a quick, painless study and gives us a good baseline of where things are at the moment. Beyond that, more in-depth studies are usually not required unless we can't really identify the problem with the ultrasound.
Well, that's really good to know that this is not like a life-threatening.
No.
I mean, I didn't like the way that leg looked. I would, scrub up with you. But in all seriousness, it's good to know that it's not life-threatening, but it does need to be addressed, because it could be an underlying situation of another disease, and besides being uncomfortable, no one wants to live with discomfort.
People lose a lot of work days. They lose a lot of their joy in life because they can't participate in the activities they want to participate in, because we have to wrap their legs because of wounds that just won't heal, then get infected and have to be treated with antibiotics. And we're just hoping to serve a need in the community for those people who not just want their legs to look better, but become more active and feel better about being active.
100%. And how effective and what are the long-term effects and outcomes of the treatments that you provide?
So the main treatment we provide for varicose veins, or what's called superficial venous insufficiency, is we.
I love it that it's venous, that it's woman. I love it. Like, men don't have this problem. It's all women.
No, men have the problem.
Do they come to you?
Yeah.
Is it mostly like, what's the percentage of men to women?
Oh, that's a good question. It's probably 75-25. But I treat plenty
75 women or 75
75 men.
I'm just kidding with you.
But I definitely treat men. Men have this problem, and they often
Wait,
have
is
the
it a
problem.
vanity problem with them, or is it they really just don't feel
No,
comfortable?
they have swelling or discomfort, and their legs hurt at the end of the day. I mean, I treated a couple of years ago a guy who was a bartender and also a triathlete,
Oh,
and I had never seen varicose veins so bad. And he said he didn't care how they looked; it's just that his legs ached. That was it, and when your legs ache at the end of the day, it's really uncomfortable. So I do treat men, less often for cosmetic reasons.
oh, 100%. Are they doing like the injectables still with saline, or is that like passe long time ago? I did that long time. Okay, I admit it, a long time ago I did that.
We do not use it's hypertonic saline. We don't use that anymore. We use a soapy product called polydocanol or sotradecol.
And is that like long term? Does it stay?
It's got pretty good long-term results. It's hard to know because spider veins keep coming back in other areas. So we don't have a good treatment to get rid of all spider veins. But yeah, if you have a couple in an area that are particularly bothering you, we can treat that area and see what the results are and move on to other areas.
So what are the long-term outcomes for some of the slides deck that you just shared with me with the treatment options that you provide?
So someone who comes in with symptomatic varicose veins, like bulging varicose veins, legs ache at the end of the day, they just don't feel right. I often am going to treat both legs. It's usually both legs who are symptomatic. So I do have pretty good follow-up with those patients, and 9 out of 10 patients at 3 years are happy. They're happy with the treatment. About 10%, it becomes a chronic problem that's not completely solved with the treatment options we have. And I have probably about 10% of patients that still have to wear compression stockings all the time, which again is tough in this
Is
climate.
it go all like pantyhose, or just
it depends on the problem, but most people we can get away with just to the knee.
Yeah, in the fall.
I have one patient who wears his compression stockings when he goes fishing. Like the old man mows the lawn with the knee-high black socks. Like I have one patient who I love, and he wears his compression stockings to go fishing because he's not going to stop fishing, and he has to have his compression stockings on. So it's not impossible.
Anything is possible as long as you just feel good within the body you're in. That's the most important. You get back to wearing shorts. Do you have a cure for like cellulite? I'm like, okay, spider veins, varicose veins. Like, I want to wear those shorts, but the cellulite. Yeah. But what are some of the side effects of the treatment that you provide?
So very rarely, about 1% of patients can end up with, we're treating superficial veins, can end up with a deep vein thrombosis. And that's pretty rare.
And how is that treated?
We give a blood thinner for about a month, and it usually goes away. And it requires a few more office visits because we do an ultrasound just to make sure it's gotten better. And that's pretty rare. And then, occasionally we have failures. I'm very upfront when you come to see me because, like I said, I can't make your legs look like you're 18 again, but I do want to.
Why not? I thought you were coming here and you're just going to share that with
just get in the Wayback Machine and go back to that.
Back to the future.
But it's tough. I mean, and anybody who tells you that your legs are going to look perfect, I think is selling you something you may not want to buy. So
absolutely. And I always, how did you get involved in this part of surgery and in the vascular arena as a practice? It's very interesting. I mean, your background is quite varied, and you've been around the world a couple of times.
Yeah, that's a fair question. I love surgery. I love fixing problems with my hands, and I love trying to think through solutions, but I'm really a people person, and being a surgeon is, oftentimes you fix one problem and the patient never comes back, but that's not true with vascular surgery. So a lot of patients have long-term problems, not necessarily my vein patients, but the patients who have arterial problems, aneurysms, carotid disease. These are things that need to be followed for years. And I love that connection, knowing patients for a long time, and also feeling like there's things I can fix along the way. And so that's how I ended up in vascular surgery. And then as somebody who looks at venous disease, there's a lot of people out there who are, they don't have the full scope of practice to really address vein problems in the way that my practice does.
Tell me about some of the things that you do at the practice. I know that we're talking today about varicose veins and treatment and options, but you there's a whole breadth of another side to what you're doing.
Yeah. So, I mean, if you see your cardiologist and they say there's a problem with your carotid artery, you're going to have to see a vascular surgeon. So there is a huge breadth of vascular disease I treat. And I guess I would say that having all of that knowledge and all of that experience informs my ability to offer patients good options for whatever their problem is. If it's an artery problem, it's a vein problem, if they need surgery, or if they just need medical observation, we can offer all of that in my practice.
And the time we have left, what have we not spoken about that you want to share? Other than you wearing compression socks, that's your secret that everybody now knows.
Yeah, everybody should wear compression socks. I guess that's it. I would say probably the best thing you can do for your body is to not smoke, and to walk 30 minutes a day at minimum. Patients always ask what type of exercise is best for me, and at the very minimum, you should be walking 30 minutes a day and not smoking. And that's my best health advice.
Oh, that's great. Life's a little bit of a lifestyle change. That's wonderful.
Yep.
Well, I want to thank you for being my guest and for sharing all the wealth of information about everything vascular. It's really been a pleasure. And if you need the Miami Vascular Specialists, they are located at 8950, the Medical Arts Building right here in Kendall down the street. Their phone number is, just correct me if I'm wrong, 786-776-7866, or you can visit their website at miamivascular.com. Good?
Yeah.
Dr. Watch, thank you so much for being here today.
Thank you for having me.
The time, and maybe I'll come visit you.
Absolutely. We'd love to see you.
Pleasure to meet you.
Thank you.
Thank you. And for you, thank you for joining